In homes and offices across the country,
I'm on the phone every day. I work 7 days a week.
people are reaching out to strangers, those who've tested positive for the coronavirus and those who've been in contact with them.
We usually plan for about 30 minutes to an hour for the phone call. Every case is different.
Rebecca LYMAN is a contact tracer. Epidemiologists have relied on contact tracing for years to determine how people infected with a disease were exposed to it and who in turn they exposed. It's a way to stop the chain of transmission.
Contact tracing is an integral part of our COVID-19 containment strategy.
Sarah TUNEBERG helps run Colorado's testing and containment program, which is rapidly adding tracers as the state tries to flatten the COVID-19 curve here. The newly infected are provided the resources they need. Friends and family members who've been around them are told to monitor for symptoms and quarantine for 14 days.
Nothing is ever really a surprise. Most people are incredibly kind and incredibly graceful.
There's detective work involved, and far from everyone they call answers the phone.
You're almost a counselor at times when you're talking to people. You try to let them know that, hey, you're going to be okay and we're going to make it through this.
More than 800 AmeriCorps and Senior Corps members who volunteer or work for stipends will soon be part of the effort. They'll undergo rigorous training, learn how to build rapport with those on the other end of the phone.
How to have a difficult conversation with someone, how to be compassionate and empathetic during what is just an extraordinarily difficult time.
It's important to be ready to listen, in addition to asking these questions.
Contact tracing has its limits, though. It's less effective when there's exponential spread of a disease, and it only works if test results are obtained quickly, which has been a real problem in the U.S. lately.
There's no point in doing contact tracing for a case that's 7 or 10 days old already. It's not helpful. There is no silver bullet in COVID. Contact tracing will not keep us out of another wave anywhere in the world.
But it could make this wave of the coronavirus slightly more manageable, as after past disasters, many folks are signing up for community service jobs like these.
Some of our hardest and most difficult moments in the human experience also bring out the best in human nature.
It's busy, but it's important work.
Work that's largely under the radar, but could make communities a little healthier during this turbulent time. Hendrik Sybrandy for CGTN, Denver.